So today we're going to be speaking about the new COVID variant. COVID is one of those viruses that has a mind of its own. It is very mutatable. So there's a ton of different strains, Delta, Omicron, you hear all these different names in the news. But what is important about this new variant? What do we need to know? And what is important for you guys and what do we need to do? That's really what I'm going to be speaking about today. This new COVID variant is called NB 1.81 and it's coming up all over the news. It's this new variant. Some of the tests are not able to detect it as well if they can detect old strains because this is a new strain. We're going to talk about what is important with this strain. In terms of what we're going to be speaking about today, we're understanding the new COVID variant, discussing the spread of this new COVID variant and the clinical impact, reinforcing the importance of vaccination because although this is a new variant, our vaccines are well equipped and they change as the virus is mutating. Our vaccines are also getting up to date and then also preparing for potential FDA policy changes. This is a new government. This is a new time. It is imperative that we do what we need to do before services are cut, before we don't have the same access to care that we used to. This NB181 is a new COVID variant, and that was first detected in January 2025. It was classified as a variant by the World Health Organization, and it has mutations that are associated with increased transmittability. So what that means, a bunch of fancy words just to say that this new variant has a really high potential to spread, and it's a really high mutation rate, it has a high potential spread, and it has a high potential to cause a lot of infections. However, the one good thing about this is that our vaccines are still effective. So spread and prevalence. This new variant has been detected in 20 plus countries. It was first noted and first seen in the US via airport surveillance, and it was found in New York, California, and Virginia. It's the new leading cause of COVID cases. It's rising, but the Omicron still remains the most common variant. I love maps, and I think pictures are worth 1,000 words. So this is showing where the highest cases of COVID are. As the pink gets darker, that means that the amount of COVID cases increases. So if you look, New York is one of the most populous states. It's full of diversity, full of people in transit. Everybody wants to come to New York for the summer. But that also means that COVID is spreading a lot more here and a lot more prevalent here because there are just so many people. Similar to the old COVID virus, so Omicron causes a sore throat, fever, fatigue. It's not associated with any increase in hospitalization or death rate so far. It's still an emerging virus. Still, people are finding out. When COVID first came out, everybody had a cough and sore throat. And then a new strain came out and people were starting to have nausea, vomiting, and diarrhea. With this one, nobody knows what the most prevalent symptom is so far. What I've been seeing in the hospital from personal experience is that a lot of people are coming in with the same initial symptoms of a sore throat, fever, and fatigue, but this one is causing a lot of diarrhea. And so I have a couple of patients now who we had no idea what was happening. And interestingly enough, they tested negative for COVID. And then on repeat testing, they tested positive and ended up being this new NB181 strain of COVID. So with this new strain of COVID, it's presenting similarly to the old strains, but I think it's associated with a couple more abdominal symptoms as well. This is huge. And I think if you have not been paying attention to anything I said this entire presentation, please pay attention to this. Our vaccines still are effective. They provide a strong protection against severe illnesses and hospitalization, and our antivirals are also still effective. So if you get infected with COVID, whether it's Omicron, which is one of the older strains, or this new fancy NB181, I have no idea how they come up with these names, but if you get infected with this strain, you can still use antivirals. But before any of us get infected, the biggest thing is prevention. So vaccinate, vaccinate, vaccinate. I know that everybody has gotten a little bit lax with the mask wearing, with the hand washing, but for high risk individuals, I think it's still so important to have your mask on, to make sure that if you're going in an airplane or an area where there's a ton of people and congestion, maybe have a mask on, hand sanitize. I know for my grandma, she has cancer and she came to visit me and she took the subway. And I was like, Daddy, you have to wear a mask because COVID is still a problem and it's still running rampant. And the best way to protect is to prevent. And prevention is done with vaccination, mask wearing, and hand washing. And I know we've talked about that at nauseam. Please get vaccinated because vaccination can protect you from this new strain of COVID. And again, if you do get infected, don't worry. Go to a hospital or go to your urgent care, go to your primary care, and definitely get the antiviral that's still very effective. This is a reminder, if If you have not gotten boosted, please get boosted because as we know, our government has changed and things are being cut left and right. And today we might have something, tomorrow we might not. People from one country may be able to come today, they might not be able to come tomorrow. So the world is a changing place. And in order to make sure that we are staying healthy and while we have the resources, please use the resources. So please, while you guys have the ability to vaccinate, please vaccinate. Community protection still matters. Even if you're not necessarily a high risk individual, it's imperative that you vaccinate because you are protecting others who are high risk individuals. And that's why it's important to also mask and to hand sanitize. It's important to vaccinate because you're protecting not only yourself, but those in the community as well. So what can you do? Get your booster ASAP if you have not already gotten it. There's a bunch of resources and places that you can go to get it. But if you have not already gotten your vaccine booster or you haven't gotten vaccinated, please do that. Mask in high risk settings. So that's again our crowded areas. And if you're symptomatic, please test. There are still a lot of places to get free testing. So if you're symptomatic, please test. And again, as always, if you're sick, please stay home. And as information is constantly changing, please stay informed, keep up to date. And while Google is very knowledgeable and so is ChatGPT, sometimes they're not always the most reliable resources. So please reach out to organizations like Smart Universities to get the most up-to-date information. Long COVID and the symptoms of long COVID. You can have coughing or breathing problems, a loss of smell or changing taste, body aches, trouble sleeping, brain fog, fever, fatigue, mood changes. Something that's really interesting is that there's a lot of new studies that are coming out for people to kind of see the effects of long COVID and to see how we can best help people. I know like Mount Sinai is doing a study. They also do provide like some financial incentive, I believe, as well. But if you guys want to get involved or just get tested to see if there's any treatment that you'd be eligible for, like sometimes they do neurocog therapy. Some people have brain fog after long COVID. So reworking your neural connections and kind of giving your brain a little bit of therapy. Like we go to the gym to get our muscles stronger, getting your brain a little stronger. But that's also something that getting involved in these studies can help with. And so staying up to date on vaccine, there's a new 2025 booster available. And if you're unvaccinated, the dosing is 2 doses of Moderna or 3 doses of Pfizer. There's a flu shot that's also available, RSV, and the pneumonia shot. So please stay up to date on all your vaccinations. These are a whole bunch of resources and references that the information is changing daily. So the World Health Organization is really up to date. CDC honestly is my favorite because they're pretty up to date and they give you guidelines right away. In terms of your local government and your state is different than every other state because New York has such high rates of COVID and the prevalence is still so high, we get different resources than other states too. So looking at the New York State Department of Health, if we can't necessarily find a resource through the federal government, the state government might be able to provide that resource, whether it's vaccination, whether it's tests. So that's definitely a good site to look at. And then in terms of vaccines, you need Medline Plus is always great because it's got a ton of information about if somebody asks you, hey, what is COVID? Then it has a lot of good, like simple, easy to digest medical information. So with this new variant, right now, there's not a specific vaccine that's targeted for this new variant. I think they're working on one. From what I hear, I have a friend who works for the CDC in Washington, and she said that they're looking at one to hopefully come out around like when they give flu vaccine vaccination, so in September, October. But they're seeing that the old vaccine is effective. So if you're up to date on your boosters for COVID, the cool thing about the COVID vaccine is it's effective against a multitude of strains. So if you're still up to date on your boosters for COVID, then you shouldn't be affected and you should have protection against this new strain as well. Still not the most common. I think the old Omicron is still the most common. If you have protection against one cousin, that means you also have protection against the other cousin too a little bit.
Your body learns the sort of
Yeah.
general idea. At certain points, it like turned into something that is different enough that we do need a new vaccine for it. That's why we
Yeah.
keep getting these vaccines and keep getting new protection. But this will
Yeah.
still be good protection for you.
And a little analogy, if it helps at all, I think about it like our body's immune system, they're fighters. So we're in a boxing match. Even though all the COVID strains are a little bit different, they're all trained in the same academy. The opponent that you're fighting, they all have very similar fighting styles. If your body gets a vaccine and is trained to fight one COVID fighter, it's better at taking on all the other COVID fighters. And you're
Good
constantly
analogy.
getting trained with vaccines